Let us now go to disharmony of qi and blood. Since qi and blood are interrelated by mutual dependence and mutual support, when the ascent, descent, and exiting, entering of qi are disturbed, blood must be affected. Similarly, any abnormality of blood will affect qi. The most important patterns of disharmony of qi and blood are as follows. First is qi stagnation and blood stasis. When the movement of qi is impeded and qi stagnates, blood circulation is also impeded and blood becomes static. This is mainly due to the passions bottling qi up internally. Stagnation of qi and stasis of blood are closely linked to disturbance of the liver's conduction and dispersing functions. Blockage of liver qi produces distension and pain in the chest and subcostal region. As qi moves, so does blood. As qi stagnates, so does blood. Thus, qi stagnation and blood stasis often present clinically with pain, ecchymosis, masses, and swellings. Also, since the heart governs the blood vessels and propels blood circulation, when the heart's function are disturbed, blood stasis may develop and lead to qi stagnation. Second is blood stasis due to qi deficiency. In this pathological state, qi deficiency first develops. Blood stasis results from deficient qi being unable to propel blood circulation properly. For example, if the heart qi is deficient, then blood circulation lacks adequate motive force and blood stasis may develop in the entire body. Clinically, there may be ecchymosis and cyanosis of the tongue. In the elderly, abrupt qi deficiency may occur and lead to blood stasis, resulting in the body and limbs losing their nourishment, and clinically there may be hemiplegia. In therapeutics, whatever its cause, it is appropriate to treat the condition with large doses of herbs that augment qi and complement them with herbs that mobilize blood and dissolve static blood. Next is failure of qi to control blood. If the action of qi to control blood flow is weakened, the flow of blood may not be contained within the vessels. This condition is closely linked to damage or deficiency of spleen qi. When deficient qi fails to control blood flow, there may be extravasation resulting in subcutaneous bleeding and ecchymosis. If bleeding occurs in the lower parts of the body, it may be seen as hematochezia, hematuria, or in females, metrorrhagia. Next is qi collapse following massive bleeding. Since blood is the carrier for qi, when there is massive blood loss, there is also massive qi loss or collapse, resulting in deficiency or collapse of both qi and blood. The main causes of this condition are traumatic hemorrhage, metrorrhagia, and postpartum hemorrhage. Qi collapse leads to prostration of yang. Inability to warm the body and stabilize the exterior can produce profuse cold sweating. Inability of yang qi to reach the extremities of the limbs can produce cold hands and feet. Collapse of both qi and blood results in failure to nourish the head, the eyes, and the orifices. This may produce syncope. Because of the collapse of blood, the pulse is hollow, or it may be deep thread-like and indistinct. Next is deficiency of both qi and blood. This is a condition of simultaneous deficiency and impaired actions of qi, and deficiency of blood with diminished nourishment of all the organ systems of the body. It is mainly the result of chronic illnesses in which qi and blood are both consumed or damaged. In some cases, there is loss of blood first, leading to reduction of qi. In other cases, there's qi deficiency first, so that the sources of blood generation become compromised. The clinical symptoms of both qi deficiency and blood insufficiency are pallid or sallow complexion, shortness of breath with apathy, lassitude and weakness, emaciation, palpitation of the heart and insomnia, dehydration of the skin, and numbness of the limbs. Thank you so much for your attention.